next topic is hypoglycemia. Let's break down this word first so that we have a good understanding of where we'll be going tonight, and then we'll actually talk about some different categories of hypoglycemia. We'll look also at how important it is to actually treat hypoglycemia, okay? And we'll talk about the causes. Hypo again is low. Glyce or glucose refers to sugar. Glycolysis is the breakdown of sugars. Gluconeogenesis is the formation of sugars. In this case, we're looking at low sugar. Anemia has to do with the condition of the blood. Okay? The opposite of this, of course, is hyperglycemia. And what would be hyper? An excess or an elevated, right? So high or excess or elevated blood sugar, and that condition we call what? Starts with D and ends in diabetes. Right? Anybody? I feel like Ferris Bueller, right? Class? Anyone? Anyone? Bueller? Bueller? Diabetes. So, diabetes, everyone knows, is a random blood sugar greater than 200. Okay, so you prick the finger, you put it on the glucosometer, and your blood sugar is greater than 200, you have diabetes. But what happens so frequently in America when you go in and you get your blood test done, and your doctor reports, oh, you're just close this year. You're at 120. You are, we use this great word, right? You're pre-diabetic. So what do? Absolutely nothing. There's the comedian Brian Regan who says, you know, I went to the doctor the other day, or last year, and he measured my cholesterol, told me I had high cholesterol, and I came back in and he looked at me and said, what have you been doing for your cholesterol this year, Brian? Nothing. He says, yeah, I can tell. Nothing, right? And that's exactly what happens. You're pre-diabetic. Oh, good, so I can have my birthday cake again this year, and all my grandkids do. And all my friends, and go out to eat every week and do absolutely nothing about it until I come back next year and I got a little higher. Hey, you know, you're still pre-diabetic. Oh, good. I'll just keep trying. Come back in next year though, and finally I hit this magic 200. Oh no, I'm diabetic? Oh, doc, my mom was diabetic, and so was my grandpa, and my aunt was amputated below the knees, and they're on dialysis, those that are still living, but what can you do for them? Oh, no worries. We've got metformin. Oh, good, thank you. And we also have glucophage. Oh, yay. And we also have glyburide and glipizide that you can take. And so what do? We take these, and we come back, and the doctor says, oh, look, what have your sugars been running? Oh, in the morning when I check it, about 120 to 180. Good, we better increase your medication. What have you done for your health, right? How is this actually working? The mechanism of this is actually to push your liver into more of a toxic state so it can't make extra sugar. And so we actually have an impaired liver function to make us, again, lower in our blood sugar. Alright? We aren't talking about hyperglycemia though tonight. We're talking about hypoglycemia. But don't be fooled, because hypoglycemia is prediabetes. Okay? Let me say that again. When you have a low fasting blood sugar, and what are we referencing as a low range? Ideally, the blood sugar should be fasting between 85 and 100. This is ideal. Anything less than 85 is considered hypoglycemia. Okay? The interesting thing is, most lab reference ranges come in at about 65 to 100 as their ideal reference ranges, or their, all it is really, it's not even an ideal, it's just their reference range. Okay? Anything less than 70 is you at risk of having a hypoglycemic shock. Okay? Your body cannot function. There's not adequate sugar to your brain to function optimally, and you can potentially go into a hypoglycemic shock. Anything less than 60, you're potentially at risk of actually going into a diabetic coma. Okay, so the diabetic who treats his blood sugars with too much insulin, they call it a diabetic coma when he drops below, and this is an extreme hypoglycemic state, when he pushes his sugars below 60. But here's the reference range at 65, and you don't even get an L until you're already at risk of having a hypoglycemic shock. Isn't that interesting? So we want to find then a reference range, 85 to 100, a healthy ideal to keep our blood sugars in during a fasting state. Now why do we give it a range? Blood sugars are constantly fluctuating. When we look at our blood sugar responds throughout the day based upon what we're eating and is ideally attempting to stay within this range from 85 to 100. Or in other words, what happens is we eat some sugar and our blood sugar rises, and then our insulin from our pancreas is released and it drops down, and then our liver kicks in and tries to bring it back up, our thyroid, our adrenals, and on it goes back and forth in an attempt to maintain this homeostatic position. Oh, Barb. There is an extra chair in that room. Doc, you're welcome to.
I might just take that one. I'm just going to unpack.
You're welcome to unpack. And there's a outlet there by Miss Carrie.
Okay.
Okay? And you can pull a chair out of there. Is there one more in there? It's by the bookshelf. Thanks, Nicole. So really what we're looking at then is the body's trying to maintain a homeostatic state, because after we eat, really this blood sugar will surge to about 120 to 140, and then it will drop down into this range, and then it comes back and it's trying to stay in this homeostatic position. Okay? What happens when we eat the chocolate cake? That blood sugar rapidly surges, and the body says more insulin, and it pushes it out. And then we go way down. Okay? And that up and down yo-yo, the more extremes we get, the more challenge there is on the pancreas, the liver, the thyroid, the adrenals, and this yo-yo effect starts to be greater and greater until those organs are not as sensitive. Okay? Now remember, a pancreas that is over churning or over producing is actually setting itself up for burnout or failure. And if this condition persists, if this pancreas burns out and it can no longer produce insulin, what do we have again? Starts with D and ends in diabetes. Somebody said it, right? Diabetes. If you have, let's just talk about pathology for a minute. If you have bleeding gums, you are 400 times, according to the American Dental Association, 400 times more likely to have diabetes if you have bleeding gums. Okay? Because the gums actually are a site of entry for infection, and that infection loves the pancreas, and it loves to destroy the islets of Langerhans, which produce insulin. Okay? So if you think, oh, well, I just brushed and it's not a big deal, I was just brushing, I had a little blood in my gums. Well, if brushing is the same as washing your hands, Whitley, if you started washing your hands tonight after feeding the lambs with soap and water, and your hands started to bleed just as you were washing them, would you be alarmed? Absolutely, right? But how many of us wash our teeth, or brush our teeth gently, floss occasionally, because my gums always bleed when I floss? How many of us are alarmed when we see a little blood on the toothbrush, or when we expectorate in the sink, see a little blood, and we're alarmed? We should be, okay? If you aren't, tonight I want you to become more aware. You should be alarmed if you're getting bleeding gums, okay?